high dose of medications or pain, and they are extremely happy to be able to decrease the pain and decrease the medication so they can every day they can move better, they are more alert, they can relate with their family in a more comfortable way. So it's very, very, very...
And what's the side effects of radiosurgery in your experience?
I'm going to say again?
What are the side effects of radiosurgery in your experience?
I think that overall it's excellent. I mean, I do feel that it's an incredible place in the management of cancer patients and is faster than I thought, actually. I did train with I would say traditional radiation oncology in the past, and the experience is very, very good. And patients are happy, doctors are happy, and the referral physicians also are very surprised at how quickly and how long-lasting the effect of the radiation surgery is. So,
how long is the treatment, Dr. Eisen?
The treatment usually, the daily treatment is very quick. It's only 5 treatments. We do it twice a week, and it's only 5 treatments. So it's only 5 treatments, 2.5 weeks.
All right, and do you take most insurances?
All insurance, I'm available 24/7.
Well, I don't take all the insurances, but you take most insurances, Medicare,
most
Medicaid?
Of the insurance, and when the patients have any issues, our staff is pretty good. I mean, we go over the paperwork, we help them to, sometimes the patients are so, with so much information, some paperwork, and our staff really takes their time. We go over, sometimes we talk to the insurance people.
So how do the patients find you?
They can call me en español al 917-836-8105 de nuevo.
What's the number in English, Dr. Eisen?
In English, it's 917-836-8105.
All right, thank you very much. And be sure to tune in tonight to Dr. Paul Offit as our special guest.
I'm looking forward. Excellent program
All right.
tonight. Okay,
thank you.
Thank you. Bye-bye.
We have Al on the line from New Jersey. Good morning, Al.
Good morning, Al.
I think there's not enough discussion of, although it is on Google with a lot of testimony about mammograms causing cancer. Mm-hmm. And it's such a big money maker, the mammograms. Imagine 100 million women getting mammograms every year. It's a lot of money, and that's why nobody wants to talk about it. My wife died from a mammogram, and nobody wants to discuss that this is a case of the cure being worse than the disease. The sonograms or the ultrasound is a...
Okay, well, that's right. Low-dose radiation certainly can cause cancer, but the likelihood of it causing cancer is minuscule. In breast cancer, you're talking about 250,000 women who have breast cancer, and we know the death rate of cancer is 100%. The likelihood of developing a cancer from a mammogram is less than 1%. It's probably 0.001%. And obviously, if you go to a center that uses low-dose radiation, and most all centers do, you can be comfortable that it's a safe procedure. If you're morbidly in fear of mammogram, there's tests to look at the breast without radiation, and those include MRIs and ultrasound. So no one makes anyone get any tests they don't want. But I certainly would urge my loved ones to have a mammogram. I think it's safe and effective. I've seen thousands of women over 40 years, and I can tell you that the vast majority are very safe, and I've never seen a cancer caused by a mammogram. We're going to go now to Isabel. Good morning.
Hello, this is Isabel. How are you?
Fine, thank God. How are you?
Good, thank you. Thank goodness I am well. I don't have anything right now that I'm ill with, thank God.
I hope you live to be 120 and never ill.
Hope that we have quality of life for the old people that, if I do live that long.
How old are you, Isabel?
I'm 59, but I'm...
Well, 20-year-olds would probably consider you and me old, so watch out how you label us.
Yeah, right? But
we're young.
I mean, it's fearful to see people lasting so long, but their quality of life isn't that good. So do you want to last that long with bad quality of life? But anyway, I'm not calling about that right now. I don't want to take up too much of your time.
Okay, what's your question?
Well, following up on the low risk for the low dosage radiation that you just mentioned earlier. How low risk is this radiosurgery as far as radiation going into one's body?
Well, it's very safe. I can tell you that with traditional radiation, which used large fields of radiation, there were chances of secondary tumors induced, and that was probably around 1%, for example, for brain tumors. I've treated thousands of people with radiosurgery, which radiosurgery means we focus just on the tumor and not hurt the healthy tissue.
Right.
So instead of treating, let's say, 2,000 cubic centimeters of healthy tissue, we can just focus on the tumor, let's say 1 cubic centimeter. So we reduced it from 2,000 to 1 cc. And I have never, ever seen a secondary tumor caused by radiosurgery. So it's really very safe. It's not standard radiation. That's what we're trying to tell people. It's very different than standard radiation because we're focusing on the cancer, which is for most people a fatal possibility, versus a treatment, which is a curative possibility. And I can tell you that it's a very, very safe method of treatment, certainly safer than surgery and certainly safer than leaving the cancer untreated.
Right. Okay, great. So your center is called Radiosurgery Center?
Radiosurgery New York. We're located on 38th and Broadway in Manhattan. We were the first ones in America, North or South America, first ones to do stereotactic body radiosurgery. And we're devoted to safe radiation, focused on the cancer, avoiding harm to the healthy tissues.
Wow, good to know. And you've been doing this for a while.
We were the first ones, yeah. I started in radiosurgery of the brain in '86 at Harvard and kept going. In New York, we brought body radiosurgery to North and South America. We're first in the United States.
Mm-hmm. So you've been doing it here in New York for how long?
More than 20 years.
Okay, great. I don't want to take up too much of your time.
Okay, well, come and visit, and if you leave your name and address, we'll send you a package of information about our work.
Okay, well, thank you so much for answering my question.
All right, God bless you, and have a good day. We're going to go back to our sponsor,